Good morning, everyone, and welcome to another edition of Asian Pathfinders. I am Pallavi Ade, along with Shreyas Deshmukh. We are the co-founders of Asian Pathfinders, and uh, thank you for joining us today, not just on a Saturday morning, but in a very difficult time that India is going through. And we hope that through today's session, we do get some answers, because I know my discussions with Madhuri and our moderator today and others also, that, a lot of us are looking for some kind of answers. And we're not saying solutions, but some direction, I guess. And I hope that today's session just provides us that kind. So today's session is on India's health security. It's about, sorry. And our speakers today are Dr. Chandrakant Lahariya and Dr. Vivek Padvetnaya. And before I give it to Madhuri for the proceedings, I'll just give you a brief about Asian Pathfinders. So we started last year in 2020 at the start of the current pandemic, and the whole aim was to be a knowledge sharing platform where we can get scholars, practitioners, academics together to have these constructive discussions and dialogue on a wide variety of topics. And we've done sessions, as Shreyas was earlier saying before we started, that we've done something from nuclear, geopolitics, health, disaster management to, the aim is to have that informal forum where we can get people from different walks of life and have these discussions. And we do that through our fireside chats and our dialogues. Fireside chats are every Saturdays. So basically the first 3 or 4 Saturdays of the month, from 11 a.m. to 12 p.m. Indian time. And the dialogues are held on the last Thursday, which are more like a panel discussion of the month. So basically it's in the evening, and you can always check our social media pages to stay updated. So like I said, health security is part of our month-long sessions on India's internal security landscape. So the next session is on the traditional security challenges that India has, from, say, naxalism to other parts of India, but the issues that we've seen. And we have Gopal Pillai speaking, who is the former Home Minister of India. And post that, we'll be moving on to a topic which is, again, some people call it non-traditional security threats. We think it's a mix of both, but it's on climate disaster management. So we have Colonel Arjun Katoch. He will be speaking on India's action priorities, and he has been part of NDMA, National Disaster Management Authority of India. So he's a member of that. So we hope to understand a little more. We've seen these tragedies even during the pandemic, right? What happened in Uttarakhand and other parts of India. So we hope to understand this topic also further. So again, guidelines, please stay on mute, because we do record these sessions and put them on YouTube. So just to reduce the noise. And again, just the language that we use in the chat and the comments that we put in the chat section, just watch that. We all come from different walks of life. And I know today's issue is a very emotive one for a lot of us, but let's just have a very constructive discussion. But please don't shy away. Please put your questions, your comments, your experiences in the chat section. We'll really be happy to hear from you. And again, you can, like I said earlier, you can get in touch with me, Shreyas, or just write to us just to know about our upcoming sessions, and also to share any feedback. Please do. We always welcome any kind of feedback. It's always welcome. It helps us improve. So moving on to today's session, obviously our moderator today will be introducing the speakers, but before that, I'll introduce her. Madhuri is a PhD student working on group neural circuit analysis on the cellular and subcellular level at University of Cologne, Germany. She's a researcher with a wide background in neuroscience with a focus on metabolism research. Currently, as a PhD student, she's contributing to the work of RTG-NCA in Professor Matthias Hammerschmidt's laboratory at the University of Cologne. She possesses a keen interest in science meetings, translation of basic research, and helping programs involved in developing a better public healthcare system. And over the years of being in research, she has acquired skills in project planning, experimental research, data analysis, and she also is a strong believer in knowledge sharing and helping younger generation to explore the field of scientific research. So over to you, Madhuri. You're on mute.
Yeah. Thank you very much, Pallavi and Shreyas, first of all, to bring me on board. And, even finding some potential in a young researcher like me to moderate this session. I think you have kind of encouraged me to come out of the cocoon of knowingly or unknowingly what we researchers have is we are very confined to our own bench in our laboratories. I think sessions like this would not encourage only me, but others in research to even venture into public healthcare needs. And I would like to thank Vivek and Chandrakant for their valuable time. I think it is my pleasure to have them and learn from their experiences and what they could offer in policy making to create a robust healthcare system. So before even starting the session, I would like to, amidst all the noise that is going on around, give due respect and thank all the healthcare workers and doctors, nurses, and technicians who are, constantly helping us to track the cases, to do perform testings. And even at this point of time, we have proved as a society that amidst all the crises, we can come together, in such a catastrophe. And I mean, India has proved as a society of individuals coming together in such difficult times. So our discussion today is primarily aimed at understanding how can we secure the health of our citizens against future disease outbreaks and what lessons the pandemic can teach us to and help us in designing a robust healthcare system. So primarily we want to focus on what lessons we have learned. And as Chandrakant is a very firm, as Chandrakant has said, that never let a good crisis go to waste. In his book, and also since November 2020, he is a constant encouragement to everyone in the healthcare sector to take this crisis as a learning. And some of the exciting policies that help us in making a robust healthcare system. And also we want to discuss factors at governance level, which can be implemented globally and at subnational levels to avoid such catastrophic events like the pandemic right now. And at most importance, we would also like our citizens, our audiences today to, kind of know what role they have to play, in avoiding such catastrophe. So without further ado, I would like to introduce our first speaker, Dr. Chandrakant Lahariya. Chandrakant is a medical doctor and India's one of the leading public policy, vaccines, and health system experts. Chandrakant has worked with academic institutions as well as international health organizations. He has special interest in science communication and publishes regularly in leading Indian newspapers and popular magazines. He has received several prestigious awards and recognitions in the field of disease outbreaks, epidemic and pandemics. His work is eclectic mix of academic research, public policy formulation, and field implementation. In the COVID-19 pandemic, he has been a forefront of public health response. He is the lead co-author of the book, Till We Win, India's Fight Against COVID-19 Pandemic, with Dr. Gagandeep Kang and Dr. Guleria. He is considered as one of the credible voices of reason in the COVID-19 pandemic response in India. Chandrakant, over to you. But just before you could, get going with your 10 to 12 minutes of your suggestions and view, I would like to, ask you or lay the foundation of what you think is a robust healthcare system.
Thank you very much, Madhuri, and thank you very much, Asian Pathfinder, for inviting me, especially Pallavi and Shreyas, and my co-speaker, Vivek Padvetnaya. I think we are at an important juncture where we need to discuss some of the ongoing challenges as well as prepare for the future. And there could not have been better or worse time than the mid of second wave of COVID-19 pandemic. In this, talking about health security becomes really relevant, though we should have been having this kind of discourse a decade ago, a few years ago, but never too late. So in this context, I would speak for next 10 to 12 minutes outlining that why pandemics are, with every passing day, we are getting closer to a new pandemic or new emerging epidemic disease or outbreak. But then I'll also reflect upon that what should have been done or what could be done on strengthening health security in any setup. And of course, the question which you have raised, I'll touch toward the end, that why stronger health systems are so very relevant in normal times to deliver universal health coverage, but also to respond to pandemics or epidemics. So starting with health security, we know that this discourse was not happening a decade ago or somewhere. Hearing a lot about the possible pandemics or emerging threats. In the last 2 decades, we have seen a lot of new emerging or re-emerging diseases. Actually, the world and people do not remember that easily, but the last pandemic was not very long ago. Last pandemic was 12 years ago only. We know that in 2009 and 10, H1N1 swine flu pandemic was affecting citizens across the world, but the extent of pandemic was remained smaller scale, fortunately, and we had nearly forgotten. But that was not the only challenge. We had pandemic in 2009 and 10, but in last 12 years, the world has witnessed at least 6 public health emergencies of international concern, which include Ebola, Zika, rather 2 outbreaks of Ebola, and we have seen polio and other emerging challenges. So world had witnessed some public health emergencies of international concern. That's a new definition under international health regulation often used. And then experts were also talking about something called disease X. They were saying that there would be a new disease which would affect the world and we should be prepared. Experts agreed that we don't know what would be the disease or disease-causing agent, what extent it would affect, but let's assume, or they gave it a fancy name of disease X. And in that context, the idea was that we need to have a stronger health systems. We need to be ready or prepared for epidemics and pandemics. And we means every single country in the world. I would not say that no attention was given to those kind of discussion, but insufficient attention was given. Like one development which happened in the backdrop with this global discourse was formation of Coalition for Epidemic Preparedness and Innovations, CEPI. And it is thankful, we should be thankful, or the global community should be thankful to this coalition that in this pandemic, in less than a year, at least a dozen of vaccines could be, research and development could be done on those vaccines, and those could be given emergency use authorization. If mechanisms such as CEPI were not available, it might have taken far longer. A few might have developed, but not the kind of portfolio which we had. And that single initiative is proof that what could be achieved with the effective and timely planning. So, world was talking about pandemic. They were talking about the proactive and reactive approach to such emerging threats. That's what health security is all about. But when I say that world, every passing day is moving closer to a new disease threat, be it outbreak, epidemic, pandemic, there are reasons to say so. We know that how the world of 2020 or 2021 is very different from a world 100 years ago. Now we have several and faster modes of transport, which essentially mean that any of us can travel from one part of the world to another part of the world within 24 hours or even less, which essentially means a pathogen or virus or bacteria can also travel that quickly with us. And they can travel to different parts of the world, like because if from a single point many individuals started going in different direction, the pathogen can be in any part of the world. So faster mode of transport has increased the risk of pandemics. We also know that the growing and the crowded cities and insufficient city planning and the living condition of many of the citizens means that we are living, or people are living in far closer contact, and that again increase the risk of disease transmission. We know that the deforestation is resulting in more contacts between humans and wild, which essentially means that the viruses or pathogens which were hidden in the wild till now, which were not affecting the human beings, can jump to human beings and can cause the disease, because human immune system is not prepared to respond to those kind of pathogens. So deforestation is resulting in increasing risk of epidemic, pandemic. The climate change, the pathogens which could not have survived on a particular temperature are now likely to survive in those settings and temperatures, so which again increasing our risk of epidemic or pandemics or newer diseases. Then there are battery farmings or single livestock, animal livestock operations where large number of area or large area is utilized for animal farming, and which again increase the risk of disease, newer diseases or newer pathogens growing and spreading to other levels. And finally, the indiscriminate use of antimicrobials, the way it is given or prescribed or over-the-counter, people purchase antimicrobials, and at the pace which the world is developing newer antimicrobial, which is far slower than the kind of resistance which is developing. All these situations put together indicate that the world is getting closer to pandemics, epidemics, and only way which is left is we should be prepared. When I say we should be prepared, a world community should be prepared, I mean that there are different areas of action. Of course, the international health regulation has been revised, and 2007 onward, those have been implemented, and countries are assessed on those criteria. But more essentially, at the level of implementation, it means that every country needs to develop public health response capacity in their setting, and sufficiently trained health workforce should be available, and that is always a challenge. Most often, the low and middle income countries such as India do not invest enough on health. Even if they invest on health, they do not invest enough on public health system. The countries do not invest on the disease surveillance system, which is so very essential for responding to emerging diseases and for our part of health security. I don't want to use word health security too often because it looks so technical, and I want that while we talk those technical aspects and those discourses, but to raise public awareness, we need to break this in a more simpler chunks of actionable areas. Similarly, to ensure that we are prepared for future diseases, the governments need to invest or increase their financial allocation for public health services. Ensuring healthier society also requires that community and civil societies are engaged. And as I'm talking about all these aspects, if we keep reflecting in our head that if actions were done on each of these areas, whether increased government funding or training, capacity building or public health workforce in the past, India and other countries might not have been in the situation which we are now in the second wave of pandemic. The pandemic preparedness and response and health security also require that countries and government invest on healthcare services. But they invest on research and development also, research on the vaccines, research on the new drugs, and building the capacity of academic institutions. This also required that it is not enough that you set up some centers of excellence, establish collaboration between different institutions. The health security also means that health services at every level not only deliver what they can deliver, but they should also focus upon surge capacity, that some additional resources can be brought into the system. It requires international collaboration, it requires stronger national and global response. So there are a few learnings which we should be mindful and we should be preparing. In a time allotted to me in the last 2-3 minutes, I would like to focus upon that we have learned a few things from ongoing COVID-19 pandemic, and COVID-19 pandemic related discussion could be completely different topic. But what we have learned that in most of the settings where stronger health system, and health system means medical care system and as well as public health care system, wherever there were such systems, the response to pandemic was far better. When I say better, it does not mean that the virus spread could be halted, but of course could be completely halted. But of course, whatever the situation, it was tackled well. We know that the response to COVID-19 pandemic, which included isolation, testing, treatment, contact tracing, most of these were related to the public health interventions where public health workforce had to go to the field. Even the testing in epidemics or pandemics is a public health tool. Treatment was needed only for 20% of the total tested positive cases or people who were tested positive. So essentially, 80% of the people who got affected by virus required public health response. They should be contacted, their contact should be traced, they should be tested on time. Only a small fraction were required treatment services. The second learning in the pandemic is that as and when you have community participation, people participated in these interventions, and then you can halt the pandemic. If people do not adhere and follow those behavior, pandemic and disease spread cannot be stopped. But people are likely to follow those behavior only when your public health system is functioning well. So pandemic health security is very much linked to well-functioning health system, which is not merely medical care system, but a public health system, community participation, and close link or working of them together. What we are seeing in India and what we need to do now onward are there are many telling things. For example, the oxygen shortage in the country is a reflection of poor planning in health services, which was always the case. Indian healthcare system is not known for planning. It formulates good policies, and it was happening many of the times, but implementation is poor. So oxygen shortage, which we are facing today, reflect the lack of planning in healthcare sector. Oxygen shortage in our country also reflects that medicines and supplies which should be available at healthcare facilities. In many of the Indian states, they are provided free of cost, theoretically, but outside those facilities, there are large number of chemist stores on the same state and same facility which claim to provide free healthcare services. So there is shortage and not following what is promised. So there are many challenges. Healthcare, a well-functioning healthcare system this is last part. The well-functioning healthcare system need to focus upon 5 or 6 core components. It need to have an effective policy, the governance part, that policymakers need to understand the needs of the people. They formulate policy, they regulate health services well. They need to deliver healthcare services. So health services need to be strengthened. And those health services means not merely setting up AIIMS-like institution or medical care institute, but a public health infrastructure and primary health care. A well-functioning healthcare system need to have a required human resources at all levels, addressing those gaps and vacancies. A well-functioning healthcare system need to have a sufficient funding. India has a short of funding, in spite of political commitments, it has not increased in so many years. A well-functioning healthcare system need to have a health information system where we know that how many people are dying, and we need to properly keep their record and their health needs. A well-functioning healthcare system need to have medicine supplies available. So we have learned through this pandemic many challenges. It will be sad and unfortunate that in spite of all these learnings and all the hardship we have faced, if actions are not taken again. One of the key areas which country can do and which should be done to ensure health security and prepare for future pandemics and epidemics is strengthening India's primary healthcare system. The primary healthcare system is the best position to deliver both medical care and public health services. Primary healthcare system is something which can address epidemics also. Just an example, India has around 30,000 primary health centers, which has each of those has 6 beds, which are mostly non-functional, but they have theoretically 6 beds. India has around 6,000 community health centers, which also have 30 beds. If we put all these beds in these facilities together, it is around 160,000 beds. Learning from this pandemic, only if those beds are made functional, only if those facilities are made functional, it will provide large proportion of health services to the people where they are living closer to the people. And it can be achieved at a far lower cost than the kind of cost India is facing now. India National Health Policy has some recommendation on that, and which can, if only if the currently given recommendation in health policies in India are implemented, country would be better off and better prepared, and would be better, health security improved, and will have an ability to respond to future epidemics, pandemics. I stop here. Thank you very much.
Thank you, Chandrakant. I completely agree with your comments and observations of what we should have learned, in past couple of months and from the point when the pandemic had started in India. So we would keep the questions after Vivek's session. Now I would like to introduce Dr. Vivek Padvetnaya. Vivek is a trained medical doctor with a master's in health policy, planning and financing from the London School of Economics and the London School of Hygiene and Tropical Medicine, and a doctor in public health from the University of Oxford. In addition, he holds a diploma in business management from the Institute of Chartered Financial Analyst of Indian University. Prior to joining Jindal School of Government and Public Policy, he worked as an associate professor at the Public Health Foundation of India. Earlier to this, he worked as a researcher at the Department of Social Policy, LSE, and as coordinator of International Long-Term Policy Network based in London. In addition, he has more than a decade-long grassroots experience in development management. Vivek is passionate about making basic public health services work for the needy citizens. His research aims to inform policy and practice on evidence-based solutions to supply side, demand side, and governance barriers to ensure basic services reach the unreached. He has undertaken several original research studies and has successfully advocated for the study learnings to be considered in policy making and practice both in London and the United Kingdom. Vivek is currently an associate professor and associate dean at Jindal University, and he teaches courses related to health policy, health economics, health financing, and political economy of public policy. Over to you, Vivek.
Thank you, Madhuri, and thank you for having me here. So I think to start on, thank you, Chandrakant, for laying out a very, very broad outline for us. It's a very sobering thought that the risk of pandemic, is perhaps increasing because of the anthropogenic activities. But I think that kind of a very broad framework also helps us to start getting thinking, what we can do about it. So I'll devote maybe the next 5-6 minutes very quickly on what are the possible ways we can go forward, with the learnings of the present pandemic, and then maybe we would like to have a conversation. So suppose, as Madhuri was saying, suppose if we look at the broader question, like how do we secure the health for citizens against future disease outbreaks? This outbreak may happen locally or nationally or maybe at a global level. And does the present ordeal that all of us have been going through has any lessons to offer? And if you look at this question, then I think some of the factors which we can look into can be put into 3 broad categories. The first category are the governance factors. The second category are the health system factors, which Chandrakant elaborated so beautifully. And the third category are the social factors, what we as citizens can do to make the conditions in which we live healthy for us. So this is where I think all of us would love to hear from the rest of the audience too. So suppose, let's say, if you look at the governance factors, one thing is very clearly this pandemic has shown is that health is a global public good, public good as a concept in economics. And the pandemic has an externality whose scope is global and not just local or national. So in that context, if you have to, let us say, have a response plan to a pandemic, that response plan has to be at a global level. So when we say a response plan at the global level, so who are the various players who are involved in this? So this plan has to have a coordinated effort from the World Health Organization, number one. And number two is it needs to have organizations who have a mandate to form policies at a global level. For example, let's say the World Trade Organization or WTO. The third group of organizations involves development assistance banks like World Bank or Asian Development Bank. And the fourth group involves the regional blocs. It could be ASEAN, it should be African unions, or it could be even EU also. So these major global players across the world need to have a very coordinated response in not only, what shall I say, handling, but I would say preempting the emergence of a future pandemic. So in which case, what are the kinds of actions that this coordinated response should lead to? Is one is, of course, we need to have a global public health surveillance system, or let's say a data intelligence system, which gives us very, very early warning that, look, a pandemic might be in the offing. So how can we identify it and preempt it? This is something similar to what we have learned after the tsunami of 2010. We have several surveillance and early warning systems, which is helping us to detect possible tsunamis. So similarly, we need to learn from this pandemic, and we need to have a much more robust global public health surveillance system. And one such action we already see with the WHO entering into an agreement with the Germany in setting up such a global public health data hub. The second is that, suppose, let us say, if the pandemic seems to be emerging out, then we need to have a very clear-cut guidelines across the countries of the world as to when they have to declare the pandemic as a public health emergency, because it's a global problem. So we need a global guideline in declaring a pandemic as a global health emergency, number two. Number three, suppose, let us say, if the pandemic starts progressing, and as we are seeing now, one of the critical aspects in making services available, accessible, and affordable to people is that, do we have access to certain important vaccines, medicines, and technology? And we can see the kind of, what shall I say, the debate which is going on in terms of equity in access to COVID vaccines. So in which case, these global bodies, for example, let us say WTO and the kind of TRIPS arrangement that we have. So what mechanisms do we have, or let's say, how do we improve the existing mechanisms in terms of, let us say, lifting of the IP rights to the vaccines, or let us say, invoking compulsory licensing, in making this technology of vaccine, for example, let us say, available across the globe to even, let us say, poorer countries of the world also. So that requires a global response. Or, for example, let us say India has raised, along with South Africa in the WTO, that this lifting of IP rights should not just be restricted to vaccines. It should also involve certain medicines which might be used in treating the present pandemic. So a response to this cannot be at a national level. It requires a global concerted effort, and we see such a concerted effort happening with the US stepping in a big way. Hopefully it'll lead to some fruitful results. The fourth thing that we also need to look into it is that whenever the world experiences a catastrophic event like this, there is a need for financing, especially from the countries who are poorer, and so in which case, what mechanisms do we have to support these countries? So supporting with vaccines or supporting with medicine is one kind of a support, but financial support is also equally important in terms of enabling them to address the local factors. So one example that we have is the Pandemic Emergency Fund, which was floated by World Bank in 2017 with number of countries as well as some big philanthropic organizations in the world. And we need such mechanisms. And another idea that World Bank came up with was to float catastrophic funds, which will flow, which will direct funds into this pandemic emergency fund that they had. So we need to have such emerging, what shall I say, innovative financing mechanism through which we can help countries to fight the pandemic. The bottom line is that, unless everyone is safe, no one is safe. So in which case, that's I think is the strongest reason why we need to have a much better coordinated response from the world than what we have seen today. So then if you look at, let us say, what kind of governance factors at a national level or at a country level, which we need to have is that, I think flowing from what I said earlier in terms of, let us say, public health emergency, if I can contextualize to the Indian context, and I would love to hear comments from Chandrakant too on this, is that at the moment, we do not have very clear-cut guidelines in terms of when a country can declare a public health emergency. And our public health legislations are fairly outdated, colonial era legislations, if I may say so. And so we need to completely recode the existing public health legislations, which provide us very, very clear guidelines as, when can India declare a health disaster or a health event as a public health emergency. And this is extremely important because when we're looking at a catastrophic event at a country level, then it requires, in a federated structure like ours, it requires a coordinated action between the central governments, the provincial, that is the state government, and the local governments. And as we see, now there is a lot of scope to improve the kind of coordination between the center and the state governments in terms of handling this pandemic. So having a very clear-cut guideline would help us do that, because that guideline will tell us when to act, how to act, and who will act. So that's a need of the hour, I would say. And we at Jindal University is working on such recoding of existing public health legislations into far simpler and more relevant codes. And then, as I was saying earlier, there is also a need for increasing finance whenever we face a catastrophic event like this. So in which case, one of the suggestions made by N.K. Singh, the chairman of the Finance Commission, that has the time come for us to move health from, let us say, a state list to a concurrent list, which allows a much coordinated or maybe much bigger role for national governments to play in handling these kind of emergencies. But this idea needs to be debated. And then if you look at the last level, so we're looking at governance from a global level, we are looking at governance from a national level. And then if you look at the governance from a local level, then we need to know that, I mean, we have a wide network of local governments, nearly close to 250,000 gram panchayats we have. So how can we use the resources of the Gram Panchayat in fighting health outbreak? Because as Chandrakant was saying, one of the key aspects is to have a very robust public health surveillance network. And every member of this Gram Panchayat are local influencers, though they may not be on Instagram. So how can we empower these Gram Panchayats on one hand, and how can we leverage these resources in fighting any disease outbreak is also one crucial aspect that we need to look into. And then if you look at the second set of factors, apart from the governance factors, we need to look at the global level, we need to look at the national level, and we need to look at the local level, and how can we leverage these resources. And then if you look at the health system factors, which Chandrakant has elaborated in great details, I won't get into the details of that. So one is, of course, there is always a call made, that historically we have been underinvesting as a country. We have been underinvesting in health, as a proportion of our GDP, or a percentage of GDP doesn't go beyond, let us say, 1.7, 1.8, depending upon whose figures you take. So the question which is looming at large is that how can we incentivize the governments, both at the state level as well as the central level, to invest more on our health infrastructure in general, but also more on the research and development capacity of our country. And another critical aspect of when we look at health system factors and how can we boost up our health system factors in handling disease outbreak is how do we make our health system resilient? So then the question is, resilience to what? So first aspect of resilience is that resilience to handle the surge in demand. When we say surge in demand, is that the demand for services. For example, let us say a primary health center or health and wellness centers, which was facing, let us say, 20, 30 patients in business as usual days. Whenever a disease outbreak happens, be it, as I say, an epidemic or a pandemic, then suddenly the demand for services go up. Maybe it may shoot up to 40, 60, 80, as we see it happening across India. So in such a case, what mechanism should we have which allows these health centers, be it private or be it government, doesn't matter, to handle this surge so that the services are available and services can be accessed by the citizens? The second aspect of resilience in health system is that how do we handle the surge in demand for finance? So as we see, as I speak, or as we debate on this, we see the kind of wrangling which is going on between the center and the state governments in terms of who will pick the vaccination bill. Should the center pick up the bill, or should it be left to the states? But the point is that we need to have a mechanism to provide finances for let us say, during these kinds of catastrophic events. So do we have any lessons to learn from existing mechanisms? And India has its fair share of, what shall I say, millionaires and rich people. So can we also have a kind of a catastrophic bond which is in place? Or let us say, could we have the kind of social stock exchange which SEBI is talking in terms of will those mechanisms will help us? So this is the areas where we need to put in additional, what shall I say, thinking in terms of coming up with the financing mechanisms, which helps the states as well as the central government to respond to this pandemic in an appropriate way. And we need to remember that though we talk about inequity at a global level, in terms of there are certain countries having access to vaccines, some other countries not having access to vaccines, we also need to remember that even in the Indian context, our states, the different states and the capacity of these states to, come up with the required finance to vaccinate the citizens of them varies a lot from richer states, maybe more located on the southern part of India, to not so rich states located on the northern part of India. So how do we bridge this divide is also one question that we need to look into. And the third factor, apart from the governance factor and the health system factor, the third factor that we need to look into it is that the societal factors. As you can see, and as Chandrakant very beautifully laid out, so in essence of handling any disease outbreak is that how can we nip it in the bud, so to speak. So nip it in the bud happens by avoiding as much as possible person-to-person contact. That is to prevent the transmission or to prevent the cycle. So in which case the citizens play an important role in handling such pandemic events, in preventing the transmission from happening from one person to another person. So what role do citizens have to play, and what lessons we as a society has learned from this pandemic in our own role, apart from the role of the government, in our ability to control pandemics? I would love to hear from all the audience who are with us. So I'll stop here and yes.
Yeah, thank you very much, Vivek, for kind of, categorizing the problems into 3 different sectors, which are at governance level and at societal level, and how can we kind of improve the factors in the health system to make it more affordable and accessible. So I would like to kind of discuss a bit more into what these laws and frameworks have been in discussion past a year, right when the pandemic was started, and we are kind of learning and improvising on it, right? So to start with, at the governance level, it is very important that we adhere to the programs that the WHO has designed for global surveillance. So global disease detection program, which the WHO had put in place a few years ago when the SARS virus had started, had kind of employed infrastructure to train members to learn machine algorithms or artificial intelligence in data analysis. So this is very essential to kind of get a prediction of or a trajectory of what can happen and how can we prevent the catastrophe. So as I said in our conversation, in our emails, that here in Germany we have the Robert Koch Institute, where the German government highly relies on the Robert Koch Institute data every week. So they have a system called as the Alarm Signal Project, which is highly dependent on mathematicians and machine learning algorithms to kind of send signal on a weekly basis if there is a high incidence of cases in a particular region. And immediately the state and the national government are sent alarms and they impose, required actions. So I want to know that even in India, we have programs like Niti Aayog and the Slang Lab who have been implementing machine learning algorithms to kind of have real-time data and, plot a trajectory or predict the rise in cases. But I really want to understand what went wrong when we have such systems in existence. What actually went wrong and we had a second wave of infection? So both to you and Chandrakant.
Chandrakant, would you like to take it?
Sure. Maybe you can chip in later on. So I think there cannot be difference of opinion that we need a stronger disease surveillance system in general, but also more so for epidemics and pandemics. And countries which have a weak public health system or which has a weak health system in general, the biggest sufferer is disease surveillance system, because either there are not enough human resources who can be involved in this activity, they are not trained on regular basis, They are trained and available. They don't know where to put the data and how governments do not use those data regularly. So importance of surveillance system is increasingly being recognized, but then it's not being, there is not such kind of network at the field level where insufficient health workers to collect the data. Then the trained epidemiologists and experts in surveillance are not available at district level. Those facilities like India has integrated disease surveillance program, but over the years it is improved, but there is a shortage of health workforce. So as I'm saying that we know that this need to be strengthened and there is insufficient investment. But I would come to the second part, that use of technology for these disease surveillance. I think technology can supplement, but ultimately you need to collect the data and then feed into the system, and then technology will help in analyzing or passing on, making it more real time and usable, available. So both need to be strengthened, not one or other. And to strengthen both, it requires investment from the government. It comes back to the, if you have a weak health system, you have everything which is weak, including surveillance system. So if you want to strengthen surveillance system, you need to strengthen health system, or vice versa, that if you strengthen health system, your surveillance system is also likely to be improved with that. And including health information system, use of technology, artificial intelligence, and all aspects. Where it comes back, I think in the COVID-19 pandemic, or in general, pandemics are a reminder that the cost of not investing in health systems, disease surveillance system, could be far higher than the investment you do and return it provides. The early signal detected for a particular disease can save many lives, many hospital admission, and a lot of cost to the society, which is far higher. The cost of all the challenges is far higher than the amount we can invest and prevent the challenges. So completely agree, but I would, a word of caution that for each of the setting, or at least a country, I'm not saying that in each of the Indian state, but each of the setting, we need a local solution. And in my opinion, for India, the technology will be important enabler, but the immediate urgent or first thing is putting human resources at the ground level in a manner that it covers across the country, who are trained, who can send the information, and that can be analyzed at different levels.
Yeah, I absolutely agree. I mean, yes, the training of people to kind of even help in generating or, you know, solidifying the surveillance system is extremely needed. Yeah, Vivek, your thoughts on it?
I continuing on what Chandrakant was saying, I would say that if you have to have a good, let us say, health surveillance system, then it has to come up in a very bottom-up fashion, no? Because that's the nature of the surveillance system is. So in which case, one thing we need to have is that, how can we use our local institutions? When I say local institutions, I mean our gram panchayats, or maybe even the health and wellness centers that we have. How can we use them? How can we empower them? How can we re-resource them, you know, to be able to have a very robust public health surveillance system? And this is where coordination between, what shall I say, different levels of governments, so to speak, and different arms of the government is extremely important. I have worked for about 15 years at the grassroots level with the gram panchayats, you know, and in improving access to basic services. And this is where I think there needs to be a much better coordination between the gram panchayats on one hand, which are responsible for providing all local public services, and let us say the health systems, that is the health and wellness center, and maybe the primary health center. So how can these come together to have a very robust mechanisms to, what shall I say, gather data related to health, so that we can have an early warning system? So in which there are two aspects to it. One is the data has to be gathered not just about, let us say, the patient, but it has to be gathered about certain other risk factors also, which Chandrakant was saying, you know, in the very early part of today's session. So for that, if you look at what mechanisms we have in place, one is, of course, we are having to have beginning to have a national digital health mission, which I think maybe some extent is being hampered by the present pandemic. Hopefully, it'll be rolled out, you know, once we are through this. And then also we have got this new mission by the government in terms of electronic health records. So electronic health records will collect all individual related data, of course, with suitable confidentiality and anonymity. And the National Digital Health Mission will start integrating all this into into an actionable intelligence, if I may say so. So in that context, I think we have an existing health management information system, which is well in place, especially after the NRHM came into being in 2007 or 2008. But another important aspect that also we need to look into it is that collection of data is one part of the story. But do we act on the data is another part of the story that I think we need to start acting on the data, whatever the level of data that we have, and make sure that it helps us in taking intelligent decisions. So this is where I would add. Yeah,
absolutely. It is kind of very interesting because we have systems in enforcement, right, up and running. But how could we, enforce that there is a smooth transition of information from these networks to the government? And how can we, hold the government accountable if they are not, listening to the alarm signals? Yeah, so can you have your view on it, that how can we have a smoother transition of information here?
Chandrakant?
Okay, if you want to go, you go ahead, and then I'll come back.
I think how can we make the government responsive is bit of a natural question. In that sense, there are no fixed. There's no one single solution for this, because if there were to be solutions, perhaps we would be having this debate. But I would say, coming from my background, I think especially in a democratic governance, or in a democratic society that we have, I think we the citizens would have do have a very large role, in seeing what kind of governance that we want and how do we make our political leaders, deliver on those things. So I think what I'm trying to say is that there needs to be an increasing engagement of the citizens in the affairs of the government, so to speak. Remember, we are a democratic country, and we've got, several platforms which are available for the citizens to engage. So coming with, again, because I don't have much urban experience, I come with a lot of rural experience of working in rural areas. For example, let's say we have platforms like WhatsApp, we have got platforms like Grama Sabhas. So what we can do as citizens to make these platforms functional, and through which we can make our voices heard on one hand to the government. Number two, we can hold the government to be accountable. So is these local governments are just romantic ideas? No, they are not, because I spent 5 years of my life in studying these panchayats, and we know that there are certain panchayats, example in certain states, for example, let's say Kerala, southern parts of Karnataka, where these gram panchayats are working very well, and they're really doing a good service, providing local public goods to the people. And we see that there is a kind of vibrancy which was envisaged in the constitutional amendment, in having these local governments. But the question is that how can we replicate it elsewhere, where the panchayats may not be functioning so very well? I think it's a greater challenge, and it goes beyond, let us say, to larger aspects of literacy and other factors which we need to look into.
Yeah, I completely agree. Yeah, Chandrakant, you were gonna say something.
Yeah, I think supplementing what Vivek said, that one of the key things for the success of health sector or improved health services is the citizen participation and the accountability for elected leaders. Now, one of the key issue is that our health services in India are weak because they are not considered election agenda, or people do not decide to vote based upon what their elected representatives have done on health in the field of health. People, in fact, do not even know that who is responsible for healthcare services. And over a period of time, by design, the government has passed on the responsibility to citizens, which has given an impression that if you are sick, taking care of your health is your responsibility. And even in this pandemic, that's what appears to happen, that government has left people to themselves, and people have to find services for themselves and fetch health services. So the best approach to improve health services would be that people are made aware that in urban setting, it's a primary care and public health as per the 73rd, not 73rd, the 74th Amendment in Constitution, responsibility of elected local body. So the municipal councillor or mayors of that city are responsible for primary care, public health service in urban area. health is a state subject, so service delivery is a state government responsibility, but central government also has a role. So putting all this together, the Panchayati Raj representative, ward councillor, members of legislative assembly, members of parliament, each one of them are responsible. And if people start asking them questions and holding them accountable that what you have or what they have done to improve healthcare services, till then health services will not improve, and that's a core essential to improve. And that's one important area, I would say.
Yeah.
If I may pitch in,
Questions in the chat
Madhuri.
box.
Yeah, if I may just pitch in for a moment in support of what we have been saying. Recently, I think a couple of days back, there was a news item in Times of India or one of those popular medias that a particular village panchayat in Kutch has come up with a brilliant plan to handle pandemic at its level. So it is distributing free food to the families who are affected by the COVID so that they can stay self-isolated, so they don't have to worry about where it comes from. And then it has created the beds within the village to people who are at a milder stage of disease, so they don't have to worry about traveling to distant cities, the expenses that comes with it, the anxiety and the stress which comes with that. So they have set up beds also in that panchayat itself. So they have come up with a very, very comprehensive plan as how they can handle this pandemic at the village level. So which was I mean, absolutely thrilling to see that. And as Chandrakant was saying earlier, if every panchayat does that, then I think our tertiary care hospitals won't be overloaded to the extent that they have been overloaded now. Yeah, I'm sorry for this interjection.
No, I completely agree. I was also looking towards some media news which had Kerala as a model coming up, in generating real-time data and helping people with oxygen availability and supply of foods. I think, yes, I think it is at the end the factors that we need to keep in consideration, that we have to be aware as citizens and we have to hold accountable for ourselves to have at least the knowledge of, what is going around, and also replication of what is being held at rural and panchayat levels. Yeah, very nice suggestions, and it was really nice to hear from your experiences. I would now like to take the questions from the audience.
Just one request I wanted to ask the speakers. Sorry to interject. Hope we can exceed by about 10-12 minutes because we have a few very interesting questions. So I know it's about 3 minutes to 12, but if it's okay with the speakers, if we exceed by 10 minutes, if it's okay.
Should be fine with me.
Yeah, perfect. Thank you so much. I just wanted to check because, yeah, thank you so much.
Thank you, Chandrakant and Vivek, for your time. So I just need to, because I was involved, in thinking of what you were saying.
I can see the question. Maybe I can answer the question.
Yes, that would be nice.
Okay, so I'll be very brief, and if there is follow-up questions, we can answer on this. So there are 2-3 questions. One of the comment or question is that public health should be made mandatory in school curriculum, and should be pandemic has reminded us that public health should be compulsory subject for the people. I am not sure whether it should be compulsory or not. However, it's important that these topics and aspects are discussed and taught at a various level, either optional subject or a particular scale through, I'm not sure about the school level, but definitely in the colleges, non-health graduate should have a reasonable understanding, because ultimately public health is not about health only. Public health is about social determinants and anthropological aspect and epidemiology, which require far wider understanding. So some of these introductory topics could be given as an optional for the students, and I think universities should come up with the capsules and short courses in these aspects for a wide range of people. But having said that, more importantly, I would say that rather than teaching graduate, postgraduates, educated class, the political leadership should be sensitized about public health, the importance of public health, investing in public health, and that require a different kind of approaches and public awareness. Then there is another question which say that access to healthcare, if belief in the health, one aspect we see during pandemic that lot of so this question is about lot of misinformation during the pandemic and which affected the health seeking and also timely care. Yes, we know that in this pandemic, from the very beginning, people have argued that we are fighting two pandemics, one caused by the virus and other is of information epidemic, which has adversely affected every citizen. So my suggestion is that, of course, the pandemics can be fought or diseases can be fought, providing and empowering citizen with the right kind of information. And that requires engagement of entire health community. And also it requires that we build capacity of health community, public health community in communicating science in the lay person's language. One of the key challenges is that medical doctors, public health persons, epidemiologists, and they can talk about R0 and all the complex epidemic curves. But I would say the skill of communicating complex scientific topic to general public is not given. It need to be taught. So teaching science communication to public health professionals is one of the things which should be followed. We have learned over last 1 year that how to communicate effectively to general public, and some of the infodemic has been addressed. And that could be addressed because of partnership of medical community, public health community, but also journalists and media. Now today the media is relatively well versed about the healthcare subject and public health issue than it was a year ago. So there are some of the positives which are emerging from this, but I agree that we need to improve in general the health scientific communication for community to improve health outcomes. And there is one more question which I'll answer, and then we will I'll pass on to Vivek. I saw one question, both speakers. Okay, so what is wrong with the vaccination? I think that's a separate debate, but India is a vaccination policy, COVID-19 vaccination policy is really complicated and need simplification. 2-3 things which every expert is talking, and I had I published about that in 26 February 2021 in Times of India, that the vaccination in emergency period is in a COVID-19 pandemic is a public good with positive externalities. Benefit of vaccination will go beyond the person vaccinated. People are already in pandemic. The COVID-19 vaccine should be free. That's what all the countries except India are doing for all the citizens. Even the most privatized healthcare system, United States of America, which never deliver any healthcare services for free, is delivering free healthcare, free vaccination. So vaccines should be free. That's one. Second, there is no point of having differential rate within the government for state government and union government. So should be one price even for the private sector. And third, the vaccination program, like India deliver routine immunization program, where all the vaccines are procured by central government and given to state. State governments do not have any experience of purchasing vaccines. Rather, one of the core weak capacity in health services in India is a procurement and supply capacity of state government. So they don't have purchasing capacity. So the central government should purchase vaccine, deliver. And fourth point is, in my opinion, because vaccines I have worked long, is that India has opened vaccination little too early for 18 to 44 years, everyone in that age group. It should have been phased manner with the targeted beneficiary. So there are many things which have a scope for improvement. And I think there is still some time for India to take corrective actions. We know that the vaccines would not be enough to administer to the kind of population it has been opened. It's equally important that those are done really well. So with closing on this part, I would request everyone who is listening that whatever the challenge is now, since eligibility has come and vaccines are going to be an important tool, if you are eligible, please go and get your vaccines. At least the vaccines are safe, effective, they work. So if you have your opportunity, please get vaccinated and encourage others to vaccinate.
Yeah, Vivek.
Yeah, I was just putting up the hand for Chandrakant's suggestion that, please offer your arm for the jab. So I have offered mine, and all those who are here, whenever your turn comes up, please do not hesitate to offer your arm. Yeah, I think I will just take one. I would love to hear from the audience also, especially when we look at the societal response. And one of the things that I remember from Pallavi's mail is that from a citizen's perspective. So I think it'll be good to hear some voices from the people who are part of this conversation. What do they think especially in terms of what role do citizens have to play. I'll just give one example before I stop. One is, see, when we talk about, let us say, what role me as an individual, for example, can play, suddenly there is a tendency to get overwhelmed by it. Oh, it's a national level pandemic, certain things happening, and what me as a single individual can do. It's like what I can do to tackle, let us say, climate change. You get overrun by the enormity of the problem itself. But the point is not that. Point is that we, in our own capacity, with our own limited resource, we can do a lot. One example, which I think Chandrakant may elaborate further on this, is WHO came up with an initiative early on in the pandemic, being an information volunteer. No, so there is so much of misinformation is going on, including hesitancy to offer your arm for the jab, and not just amongst, let us say, people who are not educated well, even people who are educated well, even amongst the researchers, and even amongst healthcare personnel. Now, if you look at the UK's vaccination when they first rolled it out, and there is a huge amount of vaccine hesitancy in the NHS healthcare workers, including doctors and nurses. So then the question is that how do we address this? So I think onus is upon every individual to get ourselves adequately informed, first at our level, about what is good, what is wrong, what is recommended, what is not recommended, what we can do, what we cannot do. In that sense, make ourselves adequately informed. And this is an information age where getting information is not a problem. We have got several authentic, credible sources from where we can get the information, number one. And number two is that if we make a commitment today, look, I will get myself informed everything about, let us say, what a citizen should do to prevent the further spread of pandemic. 5 points. And if I convince my next neighbor to implement that point and tell him, please communicate it forward, kind of a relay mechanism, then we can suddenly see the tremendous effect of the multiplicative power of this. So this is where I would say citizens have a role, and they need not be overwhelmed by the overall task, because each small task does definitely do contribute to this. Yeah, I think I'll stop at this. Would like to hear some voices, at least.
Yeah, so Pallavi, are we gonna take?
Yeah, we already have a volunteer, so I'm just gonna DM. So Shravan, I think you wanted to say something. Please go ahead.
Hi, am I audible?
Yeah.
Right. Thank you so much, Chandrakant and Dr. Vivek. And this is a wonderful session. I'd like to keep it short. When we talk about citizens' perspective, and when we say that how can we stop this chain or stop this pandemic, I feel the basic sense in people, be it from the educated community or the uneducated community, that is lacking. So a simple example that I can give you from the point Dr. Vivek had made, whenever there's a climate change, how responsible are we? Like simple example, if there is a rain and if we have to step out, every person, they will ensure that they are protected. They'll either carry an umbrella or a raincoat to protect themselves from the rain and to ensure that they do not fall sick, right? So that's a simple common sense that everyone should have. Like wear your mask, wear your protective gear when you're stepping out in this pandemic, and be responsible in stopping the chain.
Yeah, I absolutely agree to that, Shravan, and it is very essential during these times to adhere to those norms. Yeah, but also, here I think the main drawback or I don't know, the setback or what we lack here is how can we convince each and every person of no matter of what socioeconomic status to adhere to these norms, because not everyone in our country considers adhering to these norms as their priority, because there are majority of people in our country who are kind of struggling to even get their roti roti. So how can we even convince them? And I think what we had discussed earlier, that information volunteers, I think this is a very good idea that we could implement here in India to train our individuals to reach out to even rural areas. Yeah, so Vivek, do you have any comments on this?
Yeah. Okay, so one quick comment is that when it comes to health information or it's not enough to tell people that they need to do something. They need to wash hands or wear masks. We need to empower them that why they need to do that. And so that's what the entire scientific communication is about, empowering people to help make them decisions. And that's what makes a difference in pandemic. That's one part. But of course, that's not the only tool that empowering them. And that's where the regulation comes. And then when you say that, okay, if you don't follow the rule, then the fine will come. But one set will not work. Like you cannot be police state where you say you don't empower, you don't give information, and then expect people to follow all the rules and put fines. So there is a rule of multiple intervention, communicating information, empowering citizen, one-to-one communication of the Anganwadi worker, Asha worker to the people and convincing them, and of course some regulation, some police, some fine on not following, and that's how it works. But most importantly, final part is that it will not happen unless the people who are enforcing saying this do not follow it themselves, and that's what we have seen in India.
True.
Yeah, absolutely.
We have 2 hands up, so I know Harshika went first. So Harshika, over to you, and after she finishes, Durga Prasad, you can speak. And I also have a question for both the speakers. So once they both are done, I'll ask you the question.
Okay, yeah, thank you. Thanks for this nice session. So few points from my side is like mostly after the pandemic, many of us started understanding the news and all, and to understand the situation. But what is my view is like the kind of news which is available on our phone is global. So definitely, because it's a global pandemic, we have to follow the WHO regulations wherever necessary. And also we have to understand India is also an Asian country, so its climatic conditions are different, our food habits are different, our population is huge, so we cannot directly compare our country with any other developed nation and all. Yes, improvements have to be done. I mean, that is not a point which we cannot debate on, but direct comparison would make us look at the difference at a very big level. That's one point. And secondly, the age-old practices which we are doing, like minimum hygiene at home and having proper Indian food and avoiding much of processed foods and a bit of exercise. And we should not even much worry about going out and all, because herd immunity is one important factor which led to the control of the pandemic situation. Yes, but not during this time where the count is high or it's a kind of peak situation. But yes, as and when necessary, do not fear, step out, take all the precautions, and then make sure that your family, friends, and everyone is healthy and happy. So let's all try our best. Thank you.
Durga Prasad, please go ahead.
Thank you very much for giving this opportunity to express a bit of my views. One, today, it's not more than the pandemic. It's the fear of the pandemic that is actually eating into the minds of the people and making them more and more sick. And as Vivek has mentioned, there's a huge amount of information available, and that huge amount of information is the one which is actually causing more and more problem. Something concrete, something clear from the government saying that, yes, if you have in the first day, if you have this symptom, this is what you will do. Of course, I know the discussion had been on the global level at what should be done at a global level, but at the personal level, at the individual level, unless there is something coming concrete from the government, because government can't be saying today that yes, a third wave is coming, and tomorrow it says no, third wave will not come. This will not help. In fact, if there can be a clear, concrete, positive steps, say yes, you can contribute like this, 1, 2, 3. And in case you are affected, this is what you can do to protect yourself, 1, 2, 3. That probably, and done in an extensive fashion, using all modes of information dissemination, then probably some good will happen. That I think is something positive that the government should do, so that activate, empower every, as the word that was used, empower every citizen to understand in which way he can contribute and then accordingly contribute. Thank you very much.
Madhuri, may I ask my question?
Yeah.
Perfect. I know there are a lot of questions, and I hope we can get them answered sometime later. But one of the things that I have read, observed during this entire pandemic, and I would like Chandrakant and Vivek both to possibly touch on this, is the aspect of mental health. Mental health, where We're talking about asking people to say young kids, right, 16, 17, who are volunteering, who are becoming volunteers just to find hospital beds, people who've lost someone, anything like mental health during this pandemic or otherwise. Mental health doesn't get as much importance in India as it should. So how do you ensure mental health is part of this overall health structure of ours? I'm not, as Chandrakant said, not to use health security, but trying to get this entire framework of mental health also into our public health system. How do we do that?
Want me to answer, right?
Yeah.
Okay, so very quick reflections that, of course, we know that India has a big burden of mental health challenge. Around 120 to 150 million people are already having some one or other form of mental health challenge which requires some help. But with this pandemic, where people are directly, indirectly affected, their family members got sick, some deaths have also happened in the country, which is around 250,000 will reach soon. So what we know that following the pandemic, so mental health is a real challenge and which require immediate and urgent attention. What I would like to say that here, that individual level, we need to be mindful and it will come from support of the family member and communities, and all those need to be done, but government also need to strengthen mental health care services. More specifically in India, the mental health service provision and mental health service provider, including psychiatrists and counselors, are very far and few. The services are till district level. And we know through various programs that if health services are only at the district level, they are not used. So what should be done in weeks and months ahead, that provision of mental health care services through primary healthcare system. Government need to develop more of a teleconsultation approach and also available limited public and private sector resources. So they should make provision of that once in a week or twice in a week, those mental health counselors or psychiatrists are available on a regular basis. So that's a broad point that it need to be for next 1 year or so minimum. The mental health care services need to be offered to the wider public, and even citizens have to be mindful because this is going to be a challenging time. We know so many people are affected. They have lost loved ones, and they have it has affected like they have paid for the private sector treatment, which will also have impact on long run. So you flagged a very pertinent issue, and I guess that require a lot of attention from policymakers and individual level. I'll quickly touch two other points. So in 30 seconds each, people are asking which vaccines are better. I think current priority that get the vaccine which is available first to you. They are not comparable because of different reasons, and I don't want to elaborate on that. But simply, I would say they both are currently being administered. Both vaccines are safe and effective. They have an efficacy range which is comparable, but they head-to-head comparison is not possible. And then somebody is saying that what's wrong with the leadership and vaccine hesitant population. I guess the vaccination is another area of discussion, which can be held some other time. But key that now whatever situation is there, people are airing their view, and policymakers should be listening to it. We will get to know, but immediate priority as an individual or somebody involved in this work, we should say that we should get ourselves vaccinated and to encourage others to get vaccinated.
Yeah, absolutely. So, Pallavi, do we have some 1 or 2 minutes for closing remarks, or how do we?
No, I thought I'll let Vivek answer, and I think he can even put closing remarks into that. And then I think we can close the session after that.
Yeah, I think one quick point with regard to vaccination, what Chandrakant was saying is that in addition to that is removing vaccine hesitancy is not easy because it's not just dependent upon education or information as we see. Even in the US, if you go into it, the vaccine hesitancy is very large, and the proportion of people who are getting vaccinated, is coming down. So in which case, I think, how do we influence people's, or how do we bring about change in people's behavior is a key question. One way we can look into it is that we need to identify at every level the influences, the people whom they look up to. It could be celebrities, it could be politicians, or it could be, as I say, Gram Panchayat politicians, or it could be local celebrities, or it could be teachers. We need to find out who are these people who need to get vaccinated, and who they look up to in generally in life, who are their influences, and we need to go and get these influences to offer their arm and bring it into a wide publicity, saying that, look, I offered my arm for the vaccine, nothing happens to me, please do offer yours also. I think the role of influencers, I'm not into Instagram in a big way, but I think this is, if there is a time for influencers to influence public health, I think this is the time.
Yeah, I agree completely. Yeah. So yeah, overall, I could say that, we have to be aware and very vigilant of all the social media information, and try to read for ourselves and understand the process. And one such recommendation that I would give to all the participants is go through the book that Dr. Chandrakant has written explicitly really well, and it is readable for every average Indian citizen, where you can understand right from how the viruses have evolved, their mechanisms of how they infect, and how the vaccines work, which vaccination is good, and also his views on what we can learn from the pandemic. I think I would end, on this note that, awareness and combination of people coming together from different sectors would help us, to curtail such crisis in future. Thank you very much, Chandrakant and Vivek, for your time, and all the participants today. I think it was a very constructive start to the weekend, and maybe we all have some things in mind to ponder upon.
Yeah, thank you very much for all.
Thank you, everyone. Thank
you very much. Bye-bye.
Thank you.
Bye. Take care, everyone. Have a good weekend and a safe weekend. Take care.
Yeah, you too.
Take care and be safe.
Bye-bye.
Thank you so much, Madhuri. Thank you so much, Dr. Chandrakant and Vivek.
Thank you.
Thank you. Thank you.